It's the good old green. Woke some smead, if you will, or eatables, you know what I'm talking about? Just blah, to then 2 days of not eating and malnourishment because of the bad choices I made. I'm still that 600+ pound person who can't really move. Hello everyone, welcome to my channel. If you're not new here, welcome back. If you are new here, hello, my name is Cleo and nice to meet you. Today we will be talking about my 6-month post-op from my VSG, vascular surgery, gastronomy, whatever that stands for. I had 75% of my stomach taken out. I will be doing my skincare as well. So little backstory, my highest weight was 624 pounds. I had my surgery at 462 pounds and now I'm currently 390 pounds. So I just want to jump into the negatives so we can get that out of the way. Weight loss after surgery has definitely been trying. I have lost 72 pounds in total, which is an average of 12 pounds per month, which after surgery isn't the best. It's kind of like the universe has wanted to test me right after surgery. A lot of my eating and food gaining has been emotional, also tied in with my bipolar disorder. My psychiatrist said that a lot of my eating habits were also tied into mania episodes that I would have. I binged a lot and I was very much a food addict. I've been one for the last 24 years. I mean, the furthest I can go back and think of is like 5 years old. And the crazy part is my body doesn't react how you think it would. How a lot of time when we hear about VSG, it makes people throw up, them like having to go to the hospital from just eating a bite of Chinese food, like something like that. For me, I started to tolerate foods a lot faster. My surgeon calls it the danger zone, the 6 to 9 month, because that's when people can start tolerating. My body has always been able to heal fast. Interestingly enough, as a plus size person, my body heals pretty fast. Now, I will say there are certain things my body reacts to, like it does when I have dairy or like lactose, if you know what I'm talking about. But other than that, like, I don't have any reactions. And honestly, that's a scary thought to have when kind of like that addict part, it is like, oh, so you can have this and you can have this, like that whisper. Seriously, I've only thrown up twice, actually 3 times. And it's either because I was eating too fast because I was very hungry, or something was very greasy. Like, I don't eat red meat, so we have soy chorizo, but it's still like very greasy. I threw up after eating that, like it was bad. What also really doesn't help is that when I started going through my trials and tribulations, I started turning to the one thing I do to relieve my anxiety when my medication isn't enough, and it's the good old green. Woke some smead, if you will, or eatables, you know what I'm talking about? And what comes with that? Munchies. A lot of the time when I get the munchies, it's like I don't even get that fullness feeling. I've been better to stop myself if I'm under the influence. If I notice I'm eating too much, I'm like, yeah, my little pouch isn't gonna fit that. But my last incident that really was like, girl, you need to slow the F down. I could feel my incision so sore for 2 days that I could barely eat. And let me tell you, when your body does not absorb the amount of nutrients that it used to and you're not eating, you will feel like absolute garbage. Recently, I was coming back home from a trip on a plane and we were zooming through different airports that I wasn't really eating. The last plane we got on, I was passing out on and off that airport because I was not eating. So I go from stuffing myself and feeling just blah, to then 2 days of not eating and malnourishment because of the bad choices I made the 1 to 2 days prior. So I was like, okay, shit's gotta move. So that transitions us into mental health. Mental health is so important after the surgery, because let me tell you something, you're not going to have this type of surgery unless you have something mental going on. You don't get to 600 some pounds because you just have a normal life, you're just living your life. No, that's not how this works. Around about a month after surgery, I kind of got into this hole where I couldn't afford therapy at the time, and my MOOP, or my maximum out of pocket, had not been on file yet. So I had to stop going to therapy for a few months, which of course doesn't help with my episodes, my flare-ups, my anxiety. So of course that's why I turned more to edibles and weeds and things like that. Once my maximum out of pocket finally hit, bet your butt I scheduled an appointment with my therapist. She just lets me just spill everything out, and she just picks certain things that I say and then puts it together, and she's like, let's try this. And then I try that and I feel a million times better. Let me tell you, if you are not in therapy right now, even if you think you don't need it, it's just amazing to go to a stranger or a third party that you can talk to and word vomit, and they're paid to give you advice on what you should do, or like, I really appreciate that woman. You have no idea. One of the other things that she really encouraged me to do is do intermittent FMLA, which is basically leave of absence from work. So whenever I have an episode or a flare-up, I can use my FMLA and it won't be a ding against me at work. I was able to get the ball rolling on that, and that has also definitely helped me with my mental, and help keep the food addict at bay. And I've been doing this for the last couple weeks, and in the last 14 days I have lost a total of 12 pounds, which is, I think, the most I've lost since that first month in surgery in the 2 weeks. So that's 7 pounds in the week. You know, that's more than half of what I was losing average in a month in this last 6 months. So I'm saying all this to say, when your surgeon stresses to you to go to therapy after surgery, do it. Please do it. It's like a breath of fresh air talking to a therapist. You know, I know it's not for everybody, but when you have a procedure like this, you need to talk to somebody. Moving on to mobility. That one's been a little bit tough, but a lot better. I mean, even before the surgery, I would always get stuck in my head about my mobility. Like, I'm still that 600 plus pound person who can't really move. You know, am I gonna walk too far? Like, just getting so worried. I had a friend tell me once, the anxiety in it is the process of getting there. Not really the act of doing it. And for me, that is so true. So I've literally been forcing myself. If somebody asks me to do something and involve something, I'm just like, I'm gonna do it. I'm just gonna tell myself I'm gonna do it as I'm getting there. Recently, we went to an art event and we had to park, and I was so worried because I didn't know how far it was. It was only like a block, 2 blocks away. And as we were walking, I noticed it was hard for me to breathe, but it was more of hard for me to breathe because I was kind of panicking. When we walked back, I was fine. I was fine the 2 blocks. So that's definitely something I've been working on. After that, we did a Halloween event a week before Halloween, and we walked several blocks. It was like a 10-15 minute walk, and I wasn't even tripping about it. I was just walking. I was wearing awful shoes. That was the only thing. But other than that, got back to the car and I was completely fine. Next morning, I was able to get up and walk around. When I was 624 pounds, hell, when I was like 500 some pounds, we would go to a store or two walking around, and the next day I could barely walk. Last week, I got up every single day in the morning, ran errands, came home, went to work, did the same thing the next day. A lot has changed. I am 234 pounds down in total, and I'm not stopping anytime soon. Surgery has definitely been a blessing, and I'm really glad I got it. Okay, guys, thank you so much for watching. If you liked this video, go ahead and give it a thumbs up. If you really liked me, you should definitely consider subscribing. I do post full videos videos here and there, but I do post shorts weekly, so definitely follow along if you would love to see that. Other than that, I will talk to you guys later. Bye.